Well, your gut is the key to much of your body's overall health, which is why diseases like ulcerative colitis can be so detrimental. UC is one of the most common inflammatory bowel diseases, or IBD. In fact, it's estimated that 1 in every 100 Americans suffer from UC or Crohn's disease. So joining us now to discuss UC and how best to manage it is Dr. George Nikias. Thanks for joining us. Do you think there's a lot of people out there that don't even know that they have this condition? They just know that, there are days where their gut is just out of order.
Emery, thank you for having me. I think you're absolutely right. I think there are many individuals out there that will have periodic abdominal cramping, even sporadic bleeding in their bowel movements, and will dismiss it as something innocuous. And they, in fact, have the early presentations of inflammatory bowel disease, including ulcerative colitis, which we're discussing today.
So what is it and what causes it?
So ulcerative colitis is one of the two cardinal inflammatory bowel diseases. The other, which you'd mentioned, is Crohn's disease. They both represent essentially unchecked inflammation in the bowel. And the difference between the two is that ulcerative colitis involves only the colon, or the large intestine, and only involves inflammation of the innermost lining of the large intestine. In contrast to Crohn's disease, which can involve any area of the intestine and tends to involve the entire wall of the intestine in many cases, and can be associated with a number of other symptoms.
And so do we know the causes at all?
The causes of inflammatory bowel disease, while they haven't been specifically clarified, probably represent some genetic predisposition toward immunity, or an autoimmune type process,
Right.
largely driven through genetics, coupled with some external influence that drives this immunity to lead to this unchecked inflammation in the gut. That can include things like intestinal infections, changes in the gut environment or the microbiome, as we've been discussing.
We're learning a lot about that.
And other environmental factors.
Yeah.
Yeah.
And so then are there people more susceptible, or are you seeing commonalities with the people who are being diagnosed with this?
Right. So since there is a genetic link, we do see that very often individuals diagnosed with ulcerative colitis and Crohn's disease carry a family history of this condition. Because it's not strictly linked to genetics, it's not the case that if someone has a history of inflammatory bowel disease in their family, they're guaranteed to get it, but it is a factor. Other issues that can impact risk for the disease include environmental factors like diet. We're seeing a rise in inflammatory bowel disease in countries that have a westernized diet, which is represented by more refined foods, preservatives, which we know can change the gut environment and potentially predispose the gut to inflammatory changes.
Man, I don't know how often we got to say it over and over again. This Western diet is not good for us. Really quickly, though, treatment, cure, what can people do?
Well, treatment is clearly available, and we have made great strides in the last 15 to 20 years to treat both these conditions. So we encourage that if anyone has symptoms suspicious for these conditions, that they speak to their health professional and get evaluated. Treatment involves typically medications to suppress inflammation, control symptoms, reduce complications, and this can be done very safely, and there are very effective, many effective treatments now that have a great safety profile.
Okay. No need to be uncomfortable.
No, absolutely not. And we know because of the rising incidence, people should have the low threshold to see their physician should these symptoms arise.
All right, go see your doctor. Dr. George Nikias, thank you so much.
Thank you.
This program is brought to you in part by Rinvoq,